A 35-year-old male patient presented with multiple itchy scaly plaques over both extensors in 6 months. On examination, multiple well-defined erythematous scaly plaque over both extensors. On scraping with scalpel over one plaque near bony prominence, we able to see multiple bleeding points on plaque. What's the name of the sign? First, we should identify what the clinical scenario will say. The clinical diagnosis psoriasis vulgaris. Why? Point number 1, multiple well-defined erythematous scaly plaque. Number 2, bilaterally symmetrical. Number 3, extensor aspects. So it perfectly fits for your psoriasis vulgaris. Yes, and the options are Kubner, reverse Kubner, Auspitz and Voronov. And the answer is yes, Auspitz sign. Let's see each sign one by one. Auspitz sign. Auspitz sign is very important topic. Each point I am depicting here is an MCQ. Auspitz sign is named after Heinrich Auspitz. It is very typical but not a diagnostic one in psoriasis. The test by which Auspitz sign is elicited is called as Gratach test. On scraping the candle wax, you are able to see coherence of wax. Likewise, on scraping the lesion, you are able to see accentuation of scales, that is called as Gratach test. For eliciting the Auspitz sign, you should choose the lesion close to bony prominence such as elbow and shin of tibia. Next, with the help of the glass slide, just scrape the lesion. You are able to see scales are shedding off. Still on further scraping, you are able to see a very thin membrane. Still on further scraping, you are able to see minute capillary bleeding points. That is called as Auspitz sign. Correlation of Auspitz sign with histopathology. Scales over the plaque corresponds to hyperkeratosis. Silvery scales occurs due to oxygen trapped in between the scales. Thin membrane seen on Auspitz sign is called as Bulkley's membrane. Multiple bleeding point occurs due to dilated tortuous dermal capillary vessels. Then, in what are all the conditions Auspitz sign is positive? Mnemonic is ASP. A stands for actinic keratosis, B stands for seborrheic dermatitis, P for plaque psoriasis. In psoriasis itself, it is negative in inverse, flexural, pustular and erythrodermic. Why? Inverse psoriasis seen over genitals, flexural psoriasis seen over flexural aspect. In inverse and flexural, they have only minimal scale, so obviously Auspitz sign is not going to be elicited. Likewise, in pustular psoriasis, you are able to see many pustules distributed over the plaque in which Auspitz sign is not able to elicit it. In erythrodermic psoriasis, only diffuse erythema, you may not able to see the plaque itself. So, Auspitz sign is positive in actinic keratosis, seborrheic dermatitis and plaque psoriasis. Right. Then comes to Kubner. What is called as Kubner phenomena? If skin lesions seen occur along the lines of trauma or scratching is called as Kubnerization. It is positive in papillosquamous disorders such as psoriasis, lichen planus, pityriasis rubra pilaris, vitiligo and Darrier disease. That is Kubnerization. It is pseudo-Kubner. If skin lesions occurs along the lines of trauma, but here it occurs due to spillage of virus. So it is positive in wart and your molluscum contagiosum. Then what is reverse Kubner? If skin lesions disappears along the lines of trauma, it is called as reverse Kubner. Then what is inverse Kubner? Inverse Kubner is otherwise called as Renbach phenomena. If you read Kubner in a reverse way, it comes as Renbach phenomena. What is inverse Kubner? When two autoimmune conditions occurs together in the same patient, one autoimmune condition will halt the progression of other one because of overlapping immunity. For example, if a patient is having both alopecia areata and scalp psoriasis, in alopecia areata, hair follicles are destroyed due to autoimmunity. But in psoriatic plaque, there is retainment of hair follicles. So psoriasis will halt the progression of your alopecia areata. That is your inverse Kubner or Renbach phenomena. What is Voronov ring? Voronov ring is just a zone of hypopigmentation around psoriatic plaque. It occurs in patients when psoriatic plaques are treated with topical steroids and phototherapy for a prolonged period of time. Why it occurs? It occurs due to decreased prostaglandin E2 level in hypopigmented zone and increased level of your interleukin 17-23 tumor necrosis factor alpha, which will inhibit melanogenesis. Interleukin 17-23 tumor necrosis factor alpha is already in increased level in your psoriatic patients. Right. What is Auspitz sign? Named after Heinrich Auspitz. Gratach test. Auspitz sign positive in actinic keratosis, sebum and plaque psoriasis. Then Kubner, skin lesions occurs along the lines of trauma, papillosquamous disorder, Skin lesions occurs along the lines of trauma but occurs due to spillage of virus, that is called as pseudo-Kubner. What is reverse Kubner? If skin lesion disappears along the lines of trauma, it is reverse Kubner. Then inverse Kubner or Renbach phenomena is two autoimmune condition occurs in the same patient. One autoimmune will halt the progression of other one. That is called as inverse Kubner or Renbach phenomena. What is Voronov sign? That is a zone of hypopigmentation around the psoriatic plaque. It occurs due to decreased prostaglandin E2 level and increased level of interleukin 17, 23 and tumor necrosis factor alpha. Right.